All right, let's go ahead and get started. This is a really important topic, medical terminology. It's really, really important. Couple introductory slides. We're going to talk about the reason why it's important, and then we're going to get into the vocabulary piece. We're not going to go in depth. Tonight's purpose is to give you some of the basics. We're also going to introduce you to how to utilize classifiers. And then if there's enough time, we're going to talk about COVID vocabulary, as well as some, vocabulary related to sexuality and the reproductive system. So onward, let's go. Okay, so covering 4 main topics. We have about an hour and a half, so we want to make sure that we touch on certain things. We're going to talk about, as I mentioned before, medical appointments, basic vocabulary related to going to the dentist, symptom terminology, and then what's happening in today's news. The majority of it relates to COVID, so we're going to, if time permits, touch on that. Also, if you guys have any other questions, feel free to put them in the chat box, and we will try to address them throughout tonight's webinar. Next slide, please. And of course, we would be remiss without thanking our sponsors. They're what allow this to happen and allow to keep it at a reasonable cost for these workshops. So thank you to our 3 sponsors, RIT, Sorensen, VRS, and MED-EL. We appreciate their support. I'll give you a second just to read that. All right, so this is a surprising statistic for the majority of society out there, that 93% of deaf children are born into hearing families. To be exact, it's 93. A lot of people throw out the 90% rule. That means 7%, actually it's a little less than 7%, because 3.5 have 2 deaf parents, which means the other 3.5 have at least 1 deaf parent and 1 hearing parent. So we're talking very, very small statistics of those who have access to language from birth. And the statistics we see pretty often are 20 to 25% of hearing parents. Of that 93%, only 20 to 25% of those hearing parents actually communicate using sign language with their children, which means that there's a large percentage of children out there that don't have access to things like incidental learning and don't have anyone that they can trust to go to with questions. Okay? It takes a village to raise a child, in particular when that child's first language might be different from that of the parents. So it's imperative that parents look for resources, reach out to deaf adults who can support them and make sure that their child has full access to this information. It's very, very important. I teach students, and I have students who come to me and ask me questions like, for example, can I get pregnant if I do X, Y, and Z? Mainly because they don't have that communication access at home. So they're going to the only people that they do have that direct communication access with. So I'm thrilled that you guys are here tonight, because really the bedrock from where this information should be coming from is the families. And you are the ones that should be communicating your values and your thoughts on these subjects with your children. Now, another statistic for you, 95% of deaf students in America are mainstreamed because of the Individuals with Education Disability Act, IDEA. Okay. That caused a shift in the dynamic of deaf education from schools for the deaf to children being in mainstream environments, which means that those children, unless these students have the ability to utilize spoken language or the families can sign, in those 2 cases, that's great. However, if that's not the case, then a lot of times those children, as I mentioned, don't have language access, have reduced language access, and are in danger about hearing a lot of miscommunication, because the only language access they typically have is through an interpreter at school. One of the nice things about ASL, it is 24/7 access, guaranteed. And parents, I know, sometimes are worried that they're going to lose their child to the deaf community. I discourage that myth. I think it's fantastic to see parents involved, and I encourage you to be involved, get involved with the community, and have that relationship with your child. Next slide, please. So, marginalized communities or groups of people. Right now, with the recent Black Lives Matter movement, we're looking at systematic racism and systematic marginalization of certain communities, in particular the Black and Brown community. Okay. And this comes from a system. We've noticed that. And the same is true for the deaf community oftentimes. In the deaf community, what they experience is not racism, it's something called autism. And it's essentially the belief that one person is superior or inferior because of their language. Also, the concept of bringing in an interpreter, for example, being, a financial hardship or being something that's just an additional responsibility that people don't want to take on. Now, to give you an example, my mother is 84. I'm bilingual. She also happens to be bilingual, and we have another family member who's well versed in the healthcare system. So they're able to kind of guide my mother through the processes she's going to as she ages in place. Now, imagine in the case, where somebody doesn't have that familiar support. Deaf people oftentimes are marginalized. Oftentimes they experience things like being misdiagnosed. They're prescribed the wrong or incorrect treatment oftentimes due to misinformation or miscommunication. I mean, my mother was misdiagnosed with pneumonia. I saw this with my own eyes. She actually had, I don't remember exactly what it was, but it was a misdiagnosis, and they were trying to prescribe her the wrong medication. Luckily, the interpreter in that situation caught onto the error and was able to rectify the situation, which I greatly appreciated. And then, of course, resources. The bulk of resources out there, particularly when it's in the medical field, are in English. They're in English print. It's very difficult to find resources in the native language of ASL for the deaf community. There are some at the end of this PowerPoint that I'm going to share with you. Now there are more than there used to be: references, dictionaries, websites, apps, things like that. One woman in particular who does a really good job, and we'll show you that resource at the end of tonight's presentation, but it's very, very important to make sure people have access to those. Now we also are seeing a growth in deaf medical professionals, deaf doctors, psychiatrists, counselors, people with PhDs. We still need more, however, there are certainly not enough. As that grows, deaf professionals in the medical field, I think you're going to see an increase in deaf people's awareness, an increase in their rights, and an increase in access to better medical treatment. Okay, last wordy slide, I promise you. Okay, so hospitals, emergency rooms, so forth and so on. We have laws in place that are supposed to protect members of the deaf community. However, these laws don't have a lot of teeth. The enforcement comes from the individuals. These are the three main laws, really two laws and then titles within the laws. So the first one is Section 504 of the Rehab Act of 73. This is rather wordy. I'll just give you a second to read over that. Essentially saying that accommodations like an interpreter have to be provided, no questions asked. And then the second law, the two titles which are outlined here, is the Americans with Disabilities Act, or the ADA. The ADA is a very scary word to a lot of businesses and a lot of entities. You say that and they really start listening. So one covers federal entities and one covers both federal and private entities. You see a lot of times with private entities, there's an issue where they don't want to provide accommodations. I've had that issue actually just 2 months ago with my son. He had an ingrown nail and he was very concerned about going to the doctor. I had to call and cancel the appointment because of his anxiety level. And the doctor's office then billed me for the cancellation because they had provided the interpreter. And of course, I had to go around and around with the doctor's office. They ended up then billing the insurance company, which they also can't do. So it's certainly a game that you have to play and something that you have to navigate. So these are important details. But bottom line is, it is a law and they're required to follow it. Next slide, please. All right. Any questions? I know I'm going rather quickly, so feel free to put any questions in the chat. And now it's time for some medical vocabulary. All right. The fun part, the vocabulary. So let's start with, I want to make sure everybody can see me. Okay. Sign for hospital. You can see some variations on this. It's the shape of a cross done with an H hand shape. So as if you draw the shape of a cross on the side of your forearm. ER is just the finger spelling of E and R. Emergency room. Okay, and I typically sign this. If somebody were to fall or an accident were to happen, they would be brought. This is a sign for brought. You don't go to a hospital, you bring somebody to the hospital or to the ER. Or urgent care, UC. Those are the main three facilities. Some people sign this for clinic. So the same movement as hospital, the same location, but with a C hand shape versus an H. Now, this is ambulance, referencing the lights. For police, I do this typically. Now I'm kind of thinking out loud. Ambulance. If I do it without context, typically I'm referring to ambulance now that I think about it. If I add the sign for police officer, then you know I'm speaking about a siren particular to a police car. Yeah. So most of the time that sign refers to ambulance. Insurance, shaky eye. In this country, that's an important thing, and without insurance, God help you. Now, the same sign or the same hand shape and movement that you would use for insurance also can mean infection. You know the difference based on the context of what you're talking about. And also the mouth morpheme you use. If you're talking about life insurance or health insurance, contextually, you understand that that's the sign you're using. Okay, so as we know, when we typically go into the hospital or the doctor's office, your first thing you get checked is your weight. That's the sign for weight. Reason being is, I don't know if you remember the old fashioned scales, which some doctor's offices still have, and that little bar keeps moving, that balanced weight keeps moving across the top. That's where that comes from. Now, of course, more and more offices have digital scales, but we still use that sign that references the old antiquated machine. This is height, because they also will check your height. Blood pressure. Now I'm just separating that as a compound sign right now, the sign for blood and the sign for pressure. In the context of the medical field, two things you see most often. This one, referencing the blood pressure cuff. So blood pressure. I hate that part where it squeezes your arm. Don't you hate that part? I don't know. It's just something. And you can feel your pulse beating in your arm. Ugh. Or the other one we see is BP, the abbreviation BP for blood pressure. And then high blood pressure. Some people actually, now that I'm catching myself, this is a little bit of an antiquated sign. They'll use this movement for blood pressure, referencing the pumping up of the blood pressure cuff. So those are the three that you'll see most often. Another very typical part of the exam is they use that very cold stethoscope and they ask you to breathe in and out. And doctors are very good about gesturing. It's funny. So take a deep breath in, take a deep breath out. And then you start to get lightheaded, right? So, or sometimes you're hyperventilating. IV, so you would reference the needle in your arm or the catheter in your arm. If you're lying in a hospital bed, you typically see those. They typically have them right at the elbow. I'm not a big fan. I hate needles. So you'll have your IV, and then you'd also spell out IV and then show that IV drip. Medicine is signed like this. And then depending on the route, and we'll talk about this a little bit more detail later. This is just the general sign for medicine. You can get into specifics in terms of the route. RX means prescription. It also can be a verb, like to prescribe. And it can be done directionally in that case. If you get a script, okay, from your doctor. Or you can be talking about something like a prescription for your glasses. So prescription glasses, okay. You can use either the sign for medicine or the RX. I don't know if I'm going too fast, but make sure I haven't missed anything. Okay, so for the next one, doctor. This is the ASL sign for doctor, okay? It comes from the French. And if I can figure out how to spell this, medicine means doctor. So my mom, who is 84, she still signs doctor with an M. Over time, it morphed into the bent, flat hand shape. A more English sign is with a D. However, if you sign it like this, people are going to be impressed and you get some extra brownie points. So I'll leave that up to you. The most important thing is don't do this, and then sign Smith for Dr. Smith. Okay, this is not a title. This is a noun, the doctor. This is an occupation, going to a doctor's office. If you're talking about the title is lexicalized, DR. Okay, so Dr. Smith would be DR Smith. If you're going to a doctor's office, it's interesting. It's interchangeable one way, but not the other way. If you were talking about going to the doctor's office, you could use the sign or the DR, but you can only use the DR when you're referring to a title. Now, nurse is like this. So with an N, referencing checking a pulse. EMT, finger spelled. Those individuals who arrive on an ambulance and help the first responders. I believe that's an acronym for emergency medical team or help me. Thank you, emergency medical technician. There we go, EMT. And then interpreters, which is part of the medical team. You don't often think about it, but they work in conjunction with the doctors or the nurses. The interpreter and I are going to take a water break there for a second. And you have the interpreter and you notice there it says VRI. That's becoming very popular now, and it's nice if it's a last minute emergency. That is video remote interpreting or video remote interpreter. Of course, now everything is remote. Before, we didn't know what remote meant. But now, essentially, that is an interpreter where they will bring in a screen. They will bring in a piece of machinery, and the interpreter will come up on the screen, which is fantastic if you're, for example, in an emergency room and a live interpreter hasn't been able to get there yet. Instead of waiting 1 or 2 hours and then the interpreter finally arrives and the doctor's with another patient, they can bring in the screen and bring up an interpreter on demand, which is nice. Now, it's interesting. There's some dynamics sometimes between the medical team and the interpreter, and it's very important that in medical situations, you have an interpreter that is well-versed in that field and is able to kind of insert themselves and make sure that they are part of the medical treatment team. Next slide, please. Okay, so really the purpose of this slide is something that you can use with family members, with children for role-playing purposes. I think that's a really important part of educating children, particularly when it comes to medicine. Some things that they need to get used to when they go to the doctors is giving their name, giving their date of birth, being able to talk about, what their symptoms are. Also understanding acronyms and terminology like DOB. They're going to see that on forms for the rest of their life. It's important that they know what that means and how to articulate that. Also, being able to talk about why they're there, the reason for their visit. And then I also want to point out symptoms. So that's interesting. So this is one of the signs we see for symptoms. My personal preference is this. This is how I sign symptoms. It's a little bit more ASL. Let me move the camera so I can show you a little bit. So I'm going to do this a little slower. So signs for body, and then this indicates things coming up, unexpected things coming up with your body. So to me, that's a little bit more conceptually accurate. More formal, more English is this, symptoms. But I suggest with children, explaining what that means, things that come up with the body. And then, of course, last section here, prescription or advice. Sometimes you don't get a prescription. Sometimes it's just over-the-counter Tylenol twice a day, maybe some rest, maybe some hot compress, depending on what your issue is, so forth and so on. Or maybe just keep your legs elevated, so forth and so on. So this is just a good thing you can use to practice, maybe do some role play with your kids, take turns being, either the nurse or the patient. Next slide, please, just so they get used to that process and what's going to be expected of them at a medical appointment. Oh, okay, somebody asked me a very good question. I'm happy you brought that up. I actually forgot that. Let me make a note to myself. Great question. So OTC, over the counter. I typically spell OTC. Some people will elaborate and talk about, for example, things you can get at the CVS, something you can buy yourself, Tylenol, Advil, so forth and so on. But the general abbreviation you'll see out there is OTC, for over the counter. Good question. Okay. Next, sign for sick. And it's interesting. I'm a history buff, and do I have enough time to indulge myself? Yes, I do. So how did this sign come to be? So ASL has ways of evolving and changing things. In the past, this was the sign with flat hands. Okay. And that's just a little bit too much in terms of physical contact with the body. So over time, it just became the middle finger that makes physical contact with the body. Now, the one hand is always at the forehead. The other hand sometimes is at the stomach. Sometimes it's a little higher up on the chest, just, for the economics of time and being more efficient. And then there's this sign. Now, this means seriously ill, very sick, off your feet, for example. So there's sick, there's seriously ill, and then there's laid up, which is how you would gloss that. So that's more of a compound sign. To sneeze. Okay. Or to sneeze repeatedly. Now it's allergy season. I definitely notice spring is coming. And of course, people see you sneezing and the first thing they think is COVID. It's like, it's just allergies, or maybe not. Next, cough. There's two signs for this. One is with a C hand shape, same sign as complain. Okay, a little bit of a different movement. And depending on how much one is coughing, depending on the severity of the cough, you're going to alter the sign to mimic that. Okay, that's the range there. Or the hand shape of an S. This is typically what I use. And then this is cough. And again, you're going to change the movement depending on the severity of the cough. Runny nose looks like this. You might have a slight runny nose. Like my wife, who is hearing, hates it when I sniff. Deaf people, I'll be completely honest with you, deaf people don't have the same level of sensitivity to bodily functions and bodily sounds that hearing people do. So a really runny nose. Here's another one. Actually, it's funny. The sign for kid, this is the old sign for kid, basically coming from the fact that they always have runny noses. So I think that's a cute sign how that actually came to be. Now, some people do have like a nosebleed. Okay, so you distinguish that by using the sign for blood. So the classifier of, running, the fluid running from the nose is the same, but then you would add the sign for blood to articulate that it's a bloody nose. Now, congestion or having trouble breathing. Okay. not being able to breathe out of your nose because you're stuffy or you're congested. Maybe use some nasal spray. Oh, and I just said the same thing, stuffy nose and congested. My bad. There's a little bit of a repeat there. So congested, stuffy nose, pretty much same concept. Next one is sore throat. Okay, so sore throat. You can sometimes do this. This means sore, or just do this. This is what you see most often for sore throat. And then allergies. So nose, and then the sign for enemy. So bad allergies, mild allergies. Okay. Any questions on these? We do have some more. Seeing nothing, quiet audience. All right, next slide. Okay, so to be bedridden, remember we talked about being laid up sick? Looks like this, and you want to make sure that your facial expression matches. If it's for a long time, like a month or more, really depends on I would say if it's longer than a week, that's considered a long time to be bedridden. So then you would change your mouth morpheme to show the length of time. Actually, it's funny. I'm thinking about this in real time. Okay, I would say anything longer maybe than a month. Okay, then you would see this. Even though, the bed doesn't move, the movement indicates a long period of time passing. Headache. I love this sign. It's very versatile because this is a sign for pain done at the head. Depending on the severity, you're going to change the movement, how exaggerated it's going to be. You can have stomach pain. You can have severe stomach pain. You can have shoulder pain. You can have jaw pain. So you're going to move the sign to wherever the pain is located. Yeah, very iconic sign too. Oh, migraine. Okay, so you're going to do the sign for headache, and then you're going to do migraine as a mouth morpheme. So your mouth morpheme is really going to also show the severity, not just the change in the movement. Fever. So this is an older sign, fever, like putting your back of your hand on someone's head. And then most of the time you will see temperature. Okay, so to vomit, to throw up. And it's funny, my mother, again, she uses an older sign. She uses this for throw up. We use this now, a little bit of a difference there, same idea. And then, of course, depending on if, you're vomiting repeatedly versus a one-time occurrence, you're going to change the movement of the sign to reflect that. And it's rather graphic. Okay, so injection or shot. Depending on how many you have to get, depending on which arm you get them in, then maybe you get some Band-Aids. Now, I notice it's interesting. I've been watching, and it seems that this sign is becoming more in vogue. The sign for vaccine looks more like this, depressing the plunger of the needle. Both are acceptable, but I'm noticing, particularly now, that sign becoming more popular. Chills. Chills and fever, oftentimes you see those two go together. So having a fever and having chills.
Okay, Bill, I was a half an hour late.
Not feeling well, which sucks, I know, not to feel well. And then we covered cough, diarrhea. So, and depending on the severity, you're going to change the movement, just like with the other signs. Now, constipated, the opposite. Good sign, right? Makes perfect sense. So if you're struggling and maybe need to get some prune juice or get a little bit extra exercise, drink a little extra water to finally get things going again. This is nausea. So to not feel good, to be nauseous. Cramps. So to have bad cramps. Okay, and this can be related to maybe like your menstrual cycle, getting your period, or if you ate something that didn't agree with you. And actually, it's interesting. Now I'm thinking about it. You do it one movement, okay? One or two movements if you're talking about like your period. If it's a stomach cramp from another reason, you would just do one more exaggerated movement. Okay, we already talked about vaccines. The COVID vaccine, we talked about that sign. And if you need to go into a little bit more detail, you can explain that it prevents COVID, so a shot that prevents COVID. And then sweating, everybody with us so far? Okay. Dizzy, this is dizzy. So to be dizzy. It's interesting. There's a large number of people in the deaf community who have balance issues. A lot of times they're misdiagnosed as being drunk by police when they're pulled over and things like that. Oftentimes, you go get checked out by an ENT and you come to find out that, they have some balance issues with their vestibular system. A lot of deaf people have vertigo, which you can spell or show as this, again, relates to dizzy. We talked about migraine and headache. And then bruise. I think I've got this on the wrong slide. Really, depending on where it is, you're going to put it in the location of the body where it's located. You fall, you break your knee. Oh, I'm just checking the chat box. So sweats. Okay, I think I went a little too fast with that one. Okay, thanks for bringing me back to that one. So this is sweat, like to have like when you have chills and fever and sweats. Looks like this. Okay. And it's funny, my mom, I always compare, my mother being older, she signs more older signs. So hers comes out in a forward motion. Current sign goes downward. So good question. Okay. All right. To fall. So this is representing a person with two legs. So if they were to fall, and of course you want to be careful how you're signing this ergonomically, you don't want to hurt yourself. So to do this, if somebody's walking, okay, and then they word fall. Sometimes I have to actually say it to myself to remember how to do. Yep. Sometimes it looks a little bit different. It looks almost like a K. You're not going to use a V hand shape because ergonomically that's a little bit awkward and painful. So this would be fall. Up, I'm getting some more. Sure, 1 second. Okay. So somebody's asking about the sign for insomnia. So essentially it means to can't sleep, to be up all night. So there's no particular sign. So you would add this for tossing and turning. If you're taking melatonin or whatever the case may be. So can't sleep, to be restless overnight. That's how you would describe that. Okay, the next one, hit. This is important. So suppose a person falls and they bang their head. Okay. This classifier would reference something vertical that hits you on the head. Versus you bang your leg, you bang your shin on a table, for example. Or your foot, you stub your toe. Okay, so you see that? So you're going to utilize a lot of classifiers when you're talking about hitting, just depending on the part of the body. Same might be true for cut. You might have a bad cut on your head, on your arm, wherever the case may be, on your hand. You might get a cut on your chin, on your face, so forth and so on. We've covered bruise. So again, depending on the location of the body. Swelling, so something being swollen. So if I'm talking about my right foot being swollen, I'm not going to actually bend down and do it on my body. That would be awkward. So I'm going to talk about my foot and then it being swollen, and then depending on the severity and degree of the swelling. Okay. X-ray, and I want to just emphasize the palm orientation for X. Okay, I know when people are practicing their alphabet, sometimes they overlook that. For some reason, X, the palm orientation is to the side. It is not facing forward. I see that pretty common. So X-ray. And there's a little bit of movement with the X there. And that's basically taking a picture of the body to see the bones inside. That's how you would describe that. And then, of course, you've got doctors and technicians who read the X-rays and might show a bad break or might show nothing at all. This is a sign for bone. Okay, then to feel better. Well, I'm just checking in with the chat box there. Okay, good question. So ringing in the ears. So ear and then this, which is the sign for, something ringing. I've seen some people do this, ear, and then shaking an R hand shape. I've seen it. I'm not going to discount it as right or wrong. This is really another way that you might see that shown. And then numbness. Okay, so we finger spell numb. Like, for example, if you get a shot of Novocaine, you might finger spell numb and then show that you're not feeling anything. You might say you're not feeling anything, but the word numb is finger spelled. And then tingling. Trying to think about how to articulate that. So I don't know. It's funny. Kind of doing this on the wing there. I'm just going to wing it. Yeah. So it's a weird, I would do something like this and then maybe finger spell it. Good questions. Okay. All right. So we covered hurt and pain, a broken bone. So to break, so a broken foot, a broken hand, a fracture. So a little bit different than break. So fracture looks like this. My right foot did get fractured. So now if I'm talking about a classifier, here's my foot and my fracture was right here. So on the top of my foot across the front. And I actually fractured it in 2 places. Sprain. So a sprained knee, for example, you would finger spell knee. Then you can use some classifiers to show the joint. Okay, so my knee, my kneecap was pushed out of place. I couldn't play basketball for 2 months. So to sprain. Blood. This is blood. Comes from the sign for red and then the classifier for fluid. So blood became compound. Kids and their Band-Aid. I go through a lot of Band-Aids in my house. I'm sure I'm not the only one. So, even when they're not bleeding, they get a Band-Aid. So Band-Aid, different signs for Band-Aid. I signed this for Band-Aid. Some people sign this for Band-Aid, this for Band-Aid. They all mean the same thing. And then to a bandage, be it on the head, be it on the arm, be it on the side, wherever the case may be. And cast, like a hard cast if you break a bone. Be it on your leg. People like to write on them. Okay, got a lot to cover in the chat. So for bruise, some people are asking, would you add a color marker like green or purple? So you can. Now, it's important to finger spell bruise. I would finger spell bruise. I wouldn't just say purple, but you could say purple if you're describing it. You have a bruise there, you have a purple bruise here. Yeah, that's certainly fine. Chiropractor. I've seen this for chiropractor. Yeah, so this is what I've seen, chiropractor. And I don't even know how to pronounce that one. There's like 20 syllables in that one, right? So chiropractor versus massage therapist. A little bit different movement. And then the sign for period or menstruation is like this. So if you're talking about your menstrual cycle, you would add the sign for month that goes along with that. All right, let's go. Okay. Next slide, please. Great. So allergies. Now, I'm not going to belabor the point here. This is a nice activity if you're trying to teach your kids about allergies and what the difference is between an allergen, that's a thing that then causes the symptoms that your body experiences, which we label as allergies. So talking about cause and effect and what you're reacting to. Okay, that's a list of things. And actually on the next slide, if we could go to that one real quickly. Okay, so there you go. Kind of gives a good visual there. Could we go back one, please? So this is just a good way. Oh, I'm sorry. Next slide. So again, this is a good, just kind of a nice visual for your children. So you see allergen. There is no sign for that in ASL. I would finger spell that. And then I would explain anything that causes these differences. See, I have to now. Sometimes I have to like talk to myself. Yeah. Okay. Anything that causes a reaction from your body. Anything that causes your body to have these symptoms. Okay. So anything that causes these specific symptoms or causes your body to react. And here's another way you could say that. And follow the deaf person in terms of what type of grammar do they use? Are they very visual? Are they more ASL? Are they more English? Whatever the case may be. So pollen is finger spelled. And then, of course, you can elaborate and talk about, the yellow you see on the little bees when they go in and out of the flower, when they come out and they're coated in yellow and they bring that back to their hive and so forth and so on. And, it goes from the flower to the bee. And then they go from flower to flower. That yellow dust you see on your car, for example, that's pollen. Food. For me, I'm allergic to shellfish, for example, shrimp, crabs, lobsters. Those are my big three. Some people might be allergic to chocolate. Some people are allergic to avocados. Some people are allergic to strawberries, peanuts, peanut butter. That's a big one. Plants. Some people, and I've seen this is an English sign for plants. Whenever I see that, I always envision like the letter P, a green letter P. I don't know for what reason. I just kind of almost like Sesame Street. I see a pot with a big letter P coming out of it. So this is a plant, like a fern or whatever the case may be. Pets, dogs, cats, animals. So we finger spell pets. Dust, finger spell, that's a big one. When the sun comes into the window, you can see it floating through the air. That's dust. Winter, of course, I think it tends to be worst. In the summer, it's a little bit better because I think the moisture pushes it down. Okay, so red skin or an itchiness. Dry skin, red skin. Sneezing, these are some of the symptoms. Itchy eyes or watery eyes. Nausea, probably from excess mucus and your nose running, and then dizziness. I know sometimes people get a lot of ear pressure because of the barometer, the barometric change and the barometric pressure. It makes people dizzy. So allergens and then the symptoms people experience. All right, now let's look back in the chat. Okay, so good questions. All right, so sensitivity. So to be sensitive versus to be truly allergic. Just having a repeated reaction and not trusting a specific thing. Like you could also say like something that makes you easily nauseous, or like I notice with that soap, I get itchy, maybe laundry detergent. So it seems like you're sensitive. So it's time for sensitive. Okay. So skin, this is skin. Poison ivy. Interesting, poison is the same sign as medicine. So poison ivy. I think there's three. Okay, poison ivy. Pollen, there is no sign for pollen. You would finger spell pollen. But then, of course, you can explain that, for example, it's not always we see it on bees from flowers. Trees have pollen too, but basically any plant that grows, they spread it into the air. You'll see bees coated with it, maybe to give somebody a visual when they go down into flowers, it sticks to their bodies. And then they go from flower to flower and they transfer that pollen. Cross pollination, but you would fingerspell pollen, but then give them an explanation of what it is. Really take a classifier workshop with ASDC if you want to know how to describe it. That's the best way to do it. Okay. Next slide. Okay, so basically how you ingest medicine, the route. So there's syrups or elixirs. They used to be extremely messy. They've gotten a lot better now. Now they make these nice little cups. You don't have to use a teaspoon anymore. We've got these lovely little cups with the measurements built onto the side. Keeps it nice and clean. So now, when we're talking about syrup for pancakes, it looks like this. If you're talking about syrup for medicine, you spell it out. Okay. And then you would show the classifier of taking that medicine. Then you have pills or tablets, whatever the case may be. So BCL refers to body classifier, which is a grammatical unit of ASL. So for example, if it was a topical medication, depending on where it's being administered on the body, be it a foot, be it an arm cream, eye drops, that's an ICL, an instrumental classifier. So mouth drops, eye drops, nose drops, ear drops. Okay, to go see the doctor, and then to lie down and rest. Okay, just checking in on the chat box. Oh, okay, cool. Oh, okay. So, I mean, some people are saying poison. I've seen some people do poison with a pea hand shape. Not too terribly often. I've never seen it done on the chin or on the mouth. That could be something that's regional to your area. I'm not going to say it's right or wrong. What I'm showing you guys tonight, if there's something that's different that people in your area use that. Okay. Keep your local flavor, no question. I don't like to see language globalized. I think it's important to keep those regional variations. However, if you don't have a sign in your area, this is the most standard way to do some of these. Okay, audiologist is like this. A by the ear, that's audiology, and then you add the person marker for audiologist versus an audiology appointment. Okay. And then a feeding tube. Okay, and a syringe. Okay, I'm just trying to think about what that looks like. And okay, so the interpreter's got it. Good, thank you. All right, so just describing what that looks like. So if we're talking about like a G tube, okay, so your G tube is, depending on where it's located. And then typically, you would describe it's a feeding tube and then show the location. And now the syringe is just, I would do it like this. You could do it from here. Of course, you don't want them to misconstrue and think that you're like, for example, my nephew has diabetes and he does his insulin in this location. So you want to be careful. So if you know what you're talking about and you're familiar with it, you could go ahead and show it like that, but you're going to want to give some context. Am I doing that right? Tell me if I'm right or wrong. Is that what it looks like, Audrey? Okay, so if that's what that looks like, I'm on the right track there. All right, great. Perfect. Next slide, please. All right, thank you. I want to make sure. Okay, so this is really important for children in particular. you have those capsules, different types of medication. When you describe it, it would look like this. Okay, inside there's smaller medications, and if you break it open, it makes a mess. You typically have to take it with a lot of water to get it down. Some are bigger than others. Kids are not big fans. They like the coated medications versus the capsules. They like the smaller ones. Or you can maybe get a pill splitter so they can only have to take half at a time. 2 versus taking 1. Band-Aid, we've talked about that. Large Band-Aids, small Band-Aids. Syrup, we've talked about that. We've talked about maybe nasal sprays or inhalers. Eye drops. Sometimes you could take, like for cats, they still use eye drops for oral medications. Child tamper-proof lids. And then a medicine bottle. Vitamins, this is vitamins. My kids like the gummy ones. Okay, so inhaler looks like this. Syrup you spell. Okay, not the syrup that goes on pancakes. Okay, that's pancake syrup. We're talking about like an elixir or some kind of medical syrup. It goes like this, and then you could use a classifier to describe. I might spell cough syrup now that I think about it, but then I'll typically use the classifier of, using that little measuring cup. Kids need to learn, they need to learn to be literate, and they do that through finger spelling. So now if it's an asthma inhaler, it looks like this, just to clarify, versus, a nasal spray. Okay, I like the questions. Keep them coming. Okay, so food DO would be food disorder, so eating disorder. And of course, there's a variety. You can then talk about bulimia or anorexia or so forth and so on. So food DO for food disorder. Okay, I think that's everything so far. We're doing great when it comes to time. Okay. And keep going. Please put them in the chat box. That's fine. Okay, now dental appointments. 3 big signs for this and 3 ways to do it. I sign this for dentist. This is signed for teeth. So dentist. You will also see this for dentist. A little bit awkward, I think, but you see it. And then this with the D hand shape. So that's the most common things you will see for dentist. Okay, sign for cancer. So this is interesting. Typically, the noun, we finger spell cancer. You don't sign this. You will see this, but you finger spell cancer. Now, if somebody doesn't understand that, you will then use this to describe it. You might talk about it being under control. You might talk about treatment. This is the verb, okay? You don't have a verb. You have cancer versus what cancer does to the body, okay? All right, moving right along. Now I got to think about this in real time. Wisdom, teeth. Okay, yeah. So 2 ways you can do that. The actual sign for wise or for wisdom. And then typically you have 4. So you can finger spell wisdom and then talk about wisdom teeth in the back, or you can do the sign for wisdom. Whether you have them removed or whether you keep them. Filling. If you have a cavity, you finger spell cavity, you talk about it in your tooth, and then you would drill. And then this is the old sign for silver, or this sign for silver. Of course, now they also have white enamel that they put on there to do that filling, to cover that hole. So it's more of a description of the process. If it's a front tooth, for example, there might be a hole and then you would fill it in. So again, lots of classifier use. That's why it's so important in ASL to get a filling. Just explaining that. Retainer, because it goes up against the roof of the mouth oftentimes. And if somebody, doesn't know what that sign means, then you would, of course, go into a description. After braces, you have this, it keeps your teeth aligned, and it usually goes up against the roof of your mouth. This is teeth. If somebody weren't to understand that, then you would reference one tooth to help them make that connection. Swelling, we've talked about swelling in the mouth, maybe from Novocaine or whatever the case may be, from some type of procedure, swelling of a lip. And then, of course, you can't taste anything and you drool. Always fun results of going to the dentist. X-ray, we've talked about that. A little bit different from a body X-ray, okay, where they put that big lead bib on you and then take pictures of your mouth. You have to hold that device on either side of your cheek. Okay, somebody's asking about the sign for abscess. I would say show like a swelling, a very painful swelling in the side of the mouth, and then finger spell it. Okay, orthodontia or orthodontist. What I see out there pretty often is this. This is braces. So our old sign was this back in the day. Now you see it like this, braces. And then you would do, see that? Okay, you would do braces and then dentist. Yeah. Surgery. Now remember, if you're having surgery and it's dental related, it's usually surgery of the mouth or jaw. So you could say I'm going to the dentist for surgery. That's the more neutral sign, or you could do it on the location where it takes place. Root canal. Okay, I honestly don't know what that means. Tell me what is a root canal exactly, and then I can show you how to sign it. But I know it's something bad. But procedurally, I don't know exactly what it looks like and why it's so painful. I know it's famous for that. Oh, okay. Ooh. All right. So they go all the way down. Ooh. Okay. It gives me the heebie-jeebies. Okay. So anyway, thank you. All right. So a root canal, essentially you have your tooth. I would finger spell it, certainly. There's no abbreviation or anything. Sorry. Interpreter disconnected. You would show the drilling down into the tooth. Oh, Lord. Just reading the chat box. Oh, so you can have up to, if your tooth has 3 roots, you could have, like, for example, a wisdom tooth. You would then possibly have 3. Ooh, okay, fantastic. Thank you. I've learned a lot. So a root canal involves drilling down through the tooth, but make sure you would spell it out first. Okay. Then blood. A lot of times you have dental surgery and they make you rinse and spit, and it's never pleasant. Toothpaste. Toothbrush. Now, if you're telling, the verb and the noun, go brush your teeth. So toothpaste, toothbrush, and go brush your teeth. Now, appointment, any type of appointment, same as reservation. So you could talk about doctor's appointment or a dinner reservation. Cavity, we finger spell. And if somebody doesn't understand that, you can kind of explain it's a hole in the tooth. People always ask, how many cavities did you have? Like, oh, you had 3. That's awful. Braces, we talked about that. Whitening, the little strips, or now they have the UV light that you put on there for 20 minutes or something like that, or 30 minutes. And then your teeth are all sensitive, but they are glowing. Jacqueline, you know a lot about dentistry. Maybe you've already had a root canal. There we go. I thought so. The way you're talking about it, yeah. So dental assistant in a former life. Well, there you go. Okay. Prophany. That's a word for cleaning. So that would just be going, if you go to the dentist, yeah, just get your teeth cleaned. So teeth cleaning, which I love. I love when they floss and that special thing that they put in there, and your teeth are all clean afterwards, millions of dollars later. Okay, so yeah, just a teeth cleaning. All right, very good. Next slide. I think the most important thing, I'm not going to elaborate on this, the most important thing is to use depiction verbs or depicting verbs. The old word for that was classifiers. Okay. We still call them classifiers because when they abbreviate depiction verbs DV, it often gets misconstrued with other negative terms like domestic violence and things like that. So it's just really important to use hand shapes to represent some of these things, like your teeth. Like notice the roots coming down out of a tooth, showing where the teeth are located. You can use them to describe parts of the body like the heart, showing the knees and the joints. It's just integral for anything involving the body. Showing teeth, showing jaws, showing the shape of teeth. Molars, those are the ones in the back. Those are used for chewing. They're a little bit square in shape because they're for grinding and chewing, whereas the front teeth serve a different function. Your canines, they're for biting, so they're shaped differently. You can say front teeth. You can use classifiers to describe them. Wait, you have 4, not 2. What am I doing? You can talk about the shapes. You can talk about their location within the mouth. You can talk about like molars having 3, not mean wisdom teeth, sorry, having 3. I have 2 on the top and 1 on the bottom, 2 on the left and 1 on the right. These are just very simple ways to describe some of these things. Jaw. Uppers and bottoms. Gum is not the kind you chew. We're talking about the gum that holds your teeth in place. So your gum that supports your tooth. And if you don't floss a lot, your teeth can get weak and fall out. It's very important to floss. Make sure you get in between there, tops and bottoms. Brushing your teeth, electric toothbrush. Notice the mouth morpheme there. And that you brush twice a day. That's important. 2 times a day, morning and evening. For 3 minutes. How many of you guys brush for 3 minutes? Truths. I mean, I can't say that I do. I probably make it 2 minutes, to be completely honest, but not 3. And then also you should be brushing in a circular motion. Am I right, Jacqueline? Okay, somebody's asking about mouthwash. Now I gotta kind of think out loud here. Really 2 ways. So mouthwash, compound sign, or you can just show the motion. All right, great. Next. Oh, Listerine's strong. Okay. No, this is nice. I want you to look at it and see, the website. I think, yes, livingwellwithautism.com. Really nice website. It has a lot of visuals, so you can use these to help describe things to your kids, to give them some vocabulary. So we're not going to belabor it. Just wanted to give you that resource. Crown. Okay, like in terms of dental. If I'm understanding it right, yeah, you add like a fake, you add is it the whole thing? Yeah, so it goes like on the top of your tooth. Yeah. So if it's of an upper tooth, it would be like this. If it's a bottom tooth, Notice the different orientation. So if it's a bottom tooth, you put it on top of the tooth. If it's an upper tooth, it goes up this way since they're hanging down. Okay. My family, we typically spell crown. Okay, let me double. Okay, somebody's asking, could we go back one slide? Okay, great. You might need to, it's a website you need. Okay. So is there a question about this slide, or did you just need the, are you good on this? Okay. Oh, for the slide. Okay, great. All right. Next. All right, this is for kids. This is for little ones in particular. So bathroom or pee. Some people do pee like this. This is interesting because this is also the sign for penis in a lot of places. I know parents will say this a lot of times. I see that. I think it might be regional too. And because we're talking to little ones, I usually sign this, but you do see this sometimes. So pee, poop. Interesting. So this one with children, you usually say this. Like it's kind of cute. It's almost like potty. Like, did you go poo poo? And kids go, oh, yeah, I did. And, then it's way too much information. Like, oh, I wiped myself and did all the things. It's like, oh, a little bit too literal there. So poop, pee. Now, for older people, they typically sign bowels. This is an old sign. Or like my mom signs BM for bowel movement. Different signs based on age. Burp. In Japanese culture, apparently that's a compliment. In American culture, it's not a compliment. Many deaf people do it though. It is what it is. Fart or pass gas. We talked about diarrhea already. A stomach ache, so pain in the stomach location. And then we talked about constipated already. And you want to make sure that's the hand shape. Okay, next slide. Where are we time-wise? Okay, so parts of the body. So butt is finger spelled, but I will warn you, in the deaf culture, we typically finger spell ass. We don't finger spell butt that much. It's a different register and has a different connotation in deaf communities. Some people, like for example, that's considered an inappropriate word, but in deaf culture, it's not. Butt is a little bit more formal, but in the deaf community, we finger spell ASS. It's not really considered an issue. This is a classifier that you typically see if somebody falls like ice skating and hurts themselves. You'll see that sign used. Breasts, male or female, that's a neutral sign. Depending on, if somebody has surgery or if somebody is in pain, they might describe them a little bit differently, but just the neutral signs like this. Here, let me move this so you can see. Nipples are like so. Vagina, done in neutral space. Ovaries. So now you would finger spell it and then describe what they look like using some classifiers. Uterus, you finger spell as well. Sometimes you will show the shape with classifiers. So you would finger spell it first and then show where it would be located. Penis, remember we talked about that, the confusion between that and the sign for P. Now, some people will use a more classifier-like sign. Testicles, again, the professional medical term. A lot of people will fingerspell balls. This is the sign. A little bit less formal in terms of register. It can also mean like you have a lot of nerve. And then hair, you use a classifier depending on where it's located on the body. If it's, if it's pubic hair, for example, versus armpit hair. Trying to think, how would you? Actually, yeah, I guess maybe you would just actually, no, now I know. So for example, pubic hair, you would show the location. If it's a teacher teaching a class, you're going to be a little bit more professional, maybe utilize like an anatomical model or something. You're not going to sign it on the body. Okay. That might be more reserved for if you're talking about it with your children or something like that. Okay. Next slide. So puberty, those teenage years, when their body starts to change and they become an adult, they become a man or a woman, girls become women, boys become men. So acne. Okay. You would fingerspell pimple if you just had one, depending on the location. Acne looks like this. Cramps, we talked about cramps. We talked about period or menstrual cycle. And then you can describe, ovulation, so forth and so on. That might be a little bit overwhelming, but just the general sign for period looks like this. So teenage, somebody asked me what the sign for that was. Typically you see teenager. Okay, so pads, you're going to fingerspell it. And then show basically the instrument operationally how you use it. Same thing with a tampon. So pimple, yeah, you would fingerspell and then show it depending on its location. Body odor. And then safe sex would be fingerspelled. I've seen this, but this is more appropriate. Safe and then fingerspelled sex. And then you can talk about what types of things, birth control, prophylactics, IUD, withdrawal method, if you're having those conversations. Honestly, I don't really know all the nuances there. Checking the chat box. So the sign for puberty. So there is no sign really. You would fingerspell it. Typically we fingerspell and then you could talk about it. You could elaborate and talk about body changing and growing and those types of things. I've seen it articulated growing and your body changing, talking about becoming a man or a woman, but the word itself is fingerspelled. That would be my suggestion. It's just describing what it means to making sure they understand. Oh, hold on 1 second. Good question. Mandaria. So the sign for rape versus the sign for cramp. So this is rape. One hand stays stationary, the other hand moves. The sign for cramp looks like this. And the mouth morphemes look very similar. It's different in terms of the movement, and it's also different in terms of location. Notice the movement for rape. It's a little bit more of a forward motion, and the movement is isolated to one hand. Cramp, there is a little bit of a movement with both hands, and the direction that the movement goes is different. Okay. So I do want to be cognizant of making sure that there's enough time at the end for Q&A, but I'm more than happy, just keep putting your questions in the chat box. Okay, next slide. So SEX, sex, we fingerspell that. I've seen this. We see this much less now. Intercourse. I don't even know if this is still used today. my time, they would sign like IC, like, have you had intercourse yet? IC was like a big deal back in the day. You don't really see that used that much anymore. I'm kind of thinking to myself here. Yeah. So lose one's virginity. I remember that one. This is like make love. So it's the I love you signs. Those are the most common. I mean, there's a bunch. I mean, for another time, another workshop, you could really, really get into detail there. So now pregnant. I tend to sign pregnant like this. This is another way you can do it. This is more like impregnated versus a person, I am pregnant. I am pregnant. Like, oh, I'm pregnant. Well, I guess you could use them interchangeably. So condom or rubber. Sometimes you see it this hand shape. Doesn't matter. Either way is fine. So prevention, to prevent, and then safe sex, which we fingerspell. Birth control is BC. And then if we're talking about discharge, you first give the location of the discharge, if it's vaginal versus, penis, and then you do discharge. You would sign wet. Okay. All right, next slide. Okay, and then we're not going to have time to cover COVID. After this slide, I'm going to show you some resources that you guys can utilize. So, and then any questions that you might have, we can finish up with that. So just, some caveats to this whole webinar. If you're not sure about the sign for something, or if you're not confident in your fluency, ask somebody who knows, ask a teacher, ask a native signer, ask a deaf mentor, ask them for the vocabulary, and be cognizant of the variations that are out there. There are some variations in signs due to gender, due to age, due to geographically where you live, so make sure you're cognizant of that. Use pantomime, use role play, use what you have. Okay, that's important, especially when we're having conversations about things like safety. The internet is fantastic now because there's so many visuals and resources. You can get books with visuals on it. Utilize those. Have a lot of role play activities with your children. What would you do if XYZ happened? The internet also has videos that can help kind of articulate and explain these concepts. It's a very important topic. It's an important thing to cover with your children. Okay, so we're going to end very simply with the last slide. Okay, so just very simple ones. Really, there's many, many out there. However, when it comes to sex education in particular, these are some of the best. This one right here, Bethany Gaiman's website. Sex education is a priority of hers, so that's a really good resource. And then also, the ASL Sign Language Dictionaries that comes from the Signing Naturally curriculum. Lots of good resources. If you want to take an ASL class, it talks about how to describe all these things. It talks about how to use classifiers within medical terminology. That's Signing Naturally. And then also, interestingly enough, I was pretty impressed with the first one listed there. You see this book here, the American Sign Language Medical Dictionary. Very thick book. Some of the signs are a little bit antiquated, but I would guess that the majority of them are still in use today. Again, very robust resource. You can find a lot of terminology in there. Okay, and that's it for our resources. Feel free at this point, if you have any additional questions, feel free to put them in the chat box, any vocabulary that you'd like to know that I didn't cover. If not, thank you guys so much for being here this evening. We really appreciate you joining us.